Good afternoon, everyone, and good morning to those of you joining us on the West Coast today. Simpson Consulting would like to welcome you to today's webinar presentation, Shared Responsibility Penalties under ACA, What Employers Need to Know Before January 2014. Now I would like to introduce our speakers for today. First, we have Matt Kirsting, Consulting Actuary. We have Kathy Bakich, Senior Vice President and our National Health Compliance Practice Leader, and Chris Calvert, our Senior Vice President and Health Practice Leader. Now I will turn the call over to Chris.
Thank you, Liza, and hello again, everyone. We're really happy you were able to join us today for this webinar, the latest on the Affordable Care Act and the many developments that seem to be happening more and more quickly as time goes on during 2013. Today's webinar is going to focus on the employer shared responsibility penalty. We will give you an overview, talk about, which is probably quite interesting to many of you, how to avoid the penalty, and some of the safe harbors and control group rules that have come to light. We'll also spend some time on the transition rules for the first year, and then we'll spend a little time at the end about what employers should do now, what we're telling our clients, what we're recommending folks to do at this point. Some of these actions you'll have already taken, others we're going to encourage you to take now and as the year goes on, preparing for 2014. So let's start with what the employer's shared responsibility penalty is. In essence, this is the part of the Affordable Care Act that obligates employers to cover their employees or pay a penalty. This applies to large employers, and the law has defined large employers as those with 50 or more full-time employee equivalents. By full-time, they have defined that as 30 or more hours of service per week or 130 hours of service per month. And there are various look-back rules and ways to go about measuring that, and we'll talk briefly about those. The penalty is assessed only when one or more full-time employees obtain federally subsidized coverage through the exchange. We'll talk about that subsidy. We'll talk about what a full-time employee is in more detail, but that is an important differentiator and component of the law. And, of course, the penalty is not effective until January 1, 2014, which coincides with the availability of the public exchanges for individuals and small employers. So the first thing that people want to know is if they cover their employees with health care, are those employees eligible for the federal subsidy within the public exchanges? And generally the answer to that question is no. However, there are two very important distinctions and ways in which an employee may become eligible. The first is if the employer does not provide coverage that is of minimum value. You may have heard this referred to as the 60% rule. And what this is in essence, an actuarial measurement that says that the plan you are providing covers at least 60% of standard medical costs. The second part of the ways in which an employee may actually be eligible is that if the coverage is deemed not affordable. And in terms of affordability, this measurement says that an employer cannot charge an employee for self-only premium more than 9.5% of their household income. Again, two important distinctions there. Self-only coverage, we are not talking or measuring based on family coverage. And when we say employee premium, that's your payroll contribution. So we've gotten a lot of clarity around a lot of issues in the past few months, and we're going to try and point those out as we go through the discussion.